Hi, in this video, we'd like to discuss an interesting topic regarding our Hyperemesis gravidarum treatment, our HG vaccine that we offer here for effective recovery during pregnancy. Now, our videos recently have gained traction. A lot of patients are interested, especially HG survivors, for their upcoming pregnancy. They are very keen on this treatment. They've seen our previous patient testimonies, our videos explaining how effective it is. But the most common recurring question that we get, very common topic that we get from multiple patients that are interested, is that whether or not our HG vaccine will affect the baby. This is a concern of any mother when they are taking treatment during pregnancy. Now, in this video, we'd like to explain in detail how our HG vaccine, HCG desensitizer, does not interact with the fetus at all, and rest assured there will be no side effects, and it will only solely treat your Hyperemesis gravidarum and ensure a healthy pregnancy for you as well. Now, before we explain how it actually works in mechanism, we need to talk about the placenta. Now, the placenta is one of the most obvious fetal organs that is present during pregnancy, and its primary function is to be a barrier between the mother and the fetus. This barrier function is very important because if there's any direct contact between the mother and the fetus, because the fetus is still considered a foreign entity compared to the mother, there will be an immunological reaction because the immune system will reject anything that is not the mother's tissue, the mother's type, so it will actually reject it, which will lead to a common miscarriage known as an immunological miscarriage. Besides a barrier, it also functions as secreting hormone, blood exchange, and also removal of waste products for the pregnancy. So it's a very important organ. So although it does serve as a barrier to separate several important things so that it doesn't affect the baby, the placenta only fully matures and develops towards the end of the first trimester, towards week 12 and week 14. However, for hyperemesis and for any patients who have experienced hyperemesis, they will know that hyperemesis is most dominant before that, between week 6 and week 12, where the placenta is not even fully formed. And during this period, HCG is the highest during the pregnancy. It reaches a peak, and that is where it's most severe. So when the placenta is not even formed and hyperemesis is at its peak, how can we prevent this medication from actually interacting with the fetus? Now, although there is no presence of this placenta, there is in fact a barrier present regardless of whether the placenta is fully matured, because if there's any interaction, there will be an expulsion. So there must be, in a way, molecularly, there is a structure that is actually separating mother and fetus so that the fetus can actually grow all the way towards full term so that you can give birth to your child. Now, the moment the embryo develops into a blastocyst and then it embeds itself into the endometrium during the first implantation, during that moment itself, this barrier is already formed with the help of trophoblasts and also parts of the mother's endometrium. They combine together to form this placental barrier. Although it's still not visible, we only can see the placenta. However, since the beginning of conception, implantation, there's already a barrier present, and this barrier acts like a glove. So for example, let's say when the embryo implants into the endometrium, it spreads root deeps into the mother's endometrium to reach maternal blood. However, these roots, known as microvilli, it has a barrier that is present, that is wrapping around, so that we can make it an example. It's very similar to wearing a glove. If this is the roots, then I'll be wearing a glove. This barrier is the glove. However, it's not visible to the naked eye, only visible via electron microscope. Now, this important component is formed by glucose and proteins, and is known as a fibronectin barrier, fibronectin layer. Now, this is an important invention and discovery of Antai Hospital. That is exactly how we can effectively treat recurrent immunological miscarriage, because that happens because there's a damage to this fibronectin layer. This is our discovery and our patented effective treatment as well. So this fibronectin is the immunological barrier in the molecular level, and it prevents anything from actually going through the barrier and directly reaching the fetus. Only molecules such as oxygen and glucose, amino acids, fats, urea, very small molecules can actually only go through this barrier. Otherwise, there is no interaction at all. So larger molecules such as our HG vaccine, which is actually very similar to HCG in molecular weight and size. So it's several hundred times the size of these small molecules that can actually go through. So there's no interaction at all because it cannot go through the immunological barrier, which is the fibronectin. So when there's no interaction, unable to pass through this barrier, then there's no direct contact with the fetus. So there is no potential adverse outcome because there is no direct contact. The only way it's going to get through is that if this barrier is damaged. If it's damaged, then it means that you have an underlying immunological factor that you need to have it treated. So if you have no immunological factor, there is no way that any type of medication can go through this barrier, go through this placental barrier in the molecular level to reach the fetus. So rest assured, for mothers who are seeking our HG vaccine, there is no chance of any side effect, adverse outcome, and your baby will be safe. And Antai Hospital has been offering this treatment for over the past 20 years. We have yet to see any type of adverse outcome. All of the babies were born healthy and fine. They've all grown up to be healthy individuals as well. So we've explained via the mechanism, and we have several patient testimonies to back this up over the past 20 years, with over thousands of babies born from these mothers seeking our hyperemesis treatment, their condition fully treated, and them starting their own family. So I hope this video has helped you understand how our HG vaccine works, and rest assured, I would like to reiterate that it will not cause any side effects or harm your baby because there is no direct contact, and your hyperemesis condition can be effectively treated at Antai Hospital with a full refund guarantee, and we ensure that you will have a successful pregnancy. So please do share this video to those who are seeking this HG treatment, our HG vaccine, those who are seeking their next pregnancy. Please get in touch with us via the website, talk to our consultants. Let's make some arrangements happen for you to receive this treatment as soon as possible.